clinically, there are a few clues that can point to us whether the patient has sustained any meniscus or cartilage injury. So, for example, what we want to ask during the history is whether there was any trauma. So, whether the patient has injured their knee, whether there's a twisting motion or they fall on and sudden pain or swelling inside the knee. So, if there's a meniscus or cartilage tear, there's usually quite a bit of pain. You can have a bit of effusion, i.e., swelling inside the knee. And we want to know whether they have any crepitus. So like when they range their knee, do they feel like they have something clicking inside the knee, or they feel like what we call locking? So in certain range of motion, do they feel like there's something stuck inside the knee that is like mechanically blocking the motion of their knee? And when we see the patient, when we examine the patient, we can assess clinically as well whether there's any tenderness over where the meniscus and cartilage is. And then we also at the same time examine their ligaments to see whether there's any ligamentous laxity. But of course, most of the time, even though the history and the clinical examination can give us a very good idea, we still need a confirmation through imaging, which is MRI scan, to have a proper look at it. Because even though we can diagnose it, what we want to know from the MRI scan is we want to know how bad the tear is, what's the configuration of the tear, and how we can treat it, because that will change the management depending on the size, the location, as well as the severity of the meniscus and cartilage issues. Yeah. Well, there are quite a few actually. Most common sports injuries, like what I've mentioned in my talk, are basically the shoulders and the knees. Shoulders, we see a fair share of shoulder instability, shoulder dislocation, or rotator cuff issues. Whereas in the knee, we see quite a lot of ACL tear, meniscus tear, or something like a MCL tear, for depending on what sports they are doing and how they injure the knee. Yeah, but by far, like, these are the more common ones that we see. So any sports that involve cutting motion, cutting as in sudden turn of direction. So things like football, basketball, badminton, even table tennis, we see quite a lot of knee injuries, because when they pivot on the knee, they can actually tear off their ligaments or meniscus. For other sports like I don't know, running we see very different injuries. So runners, depending on where their site of pain is, they can develop a few things. For example, they can get plantar fasciitis at the sole of their foot. They can develop shin splints if they are running too much. They can develop tight Achilles if they are not doing enough stretching, or they can develop kneecap issues if they are running at an improper technique, or they are wearing the wrong footwear, or their gait is not balanced. So yeah, I mean, depend on what the sports that they are doing and whether they come in with a traumatic event, the injury can actually depends. Yeah, again, I would say it really depends on what sports they are doing. Overtraining and lack of warm-up is definitely something that we get asked a lot, but at the same time, it's very important for us to know what they are training for, what's their routine, how much and how frequent they are training. So coming from a sports background like me, I find it's easier for me to relate to what the patient is training for and whether they are actually overtraining. So this is something that we definitely have to look at when we treat the patient, rather than just treating their injury itself. And because by looking at the root cause, we can actually prevent these things from happening again in the future. We see a lot of this pain at the end range of motion, i.e. deep squat. So a lot of weightlifters, a lot of powerlifters come to us and say they have pain at the knee when they are in the hole, which is like when they are in the deepest position in the squat. And invariably, there are two causes of that. One is they have a meniscus tear. So the meniscus tear is usually at the posterior horn, so behind at the back part of the meniscus. And when they are squatting, the thigh bone actually translates and go posterior and go behind, and that will squeeze on their meniscus tear at the back. So that's number one. Number two is if they have any cartilage lesion at the back of the knee. So if they have any cartilage lesion at the back of the knee, for example, a small ulcer there, when they are in the deep squat position, it can actually sort of exacerbate the pain where they have as well. So these are the two commonest knee source of pain that we see when a patient has got the pain at the deep squatting. Yeah. That is a very, very broad question. And I don't think there's an easy answer for that. I think at the end of the day, you really have to see what is the sport injury that the patient presents with, and also, with the severity of it, and what's the patient's lifestyle. Are they young? Are they old? Do they want to continue doing sports? And what's their expectation like? And I'll really tailor every treatment that I offer depending on all these factors.